Not, not now, after.
Good afternoon, everyone, and welcome to our webinar, Leveraging AI and Analytics to Track Disease and Pandemic Outbreak Surveillance and Rapid Response. Before we get started, I want to remind everyone that all attendees have been muted, and if you have any questions, please use the Q&A feature in your Zoom app. And at the end of the presentations, we will address all the questions that were submitted, and if we run out of time, we'll be sure to provide answers in writing to those questions and share it with the group. Today we have Dina Sanchez, an ALTERYX ACE and practice manager at PK, along with Andy Day, Senior Director, Healthcare Solutions Strategy from ALTERYX. Andy's going to start today's presentation with some research that he's done and an interesting case study, followed by Dina, who will speak about some of the history of epidemiology and how medical geography has been utilized in tracking past diseases and outbreaks. She'll also walk us through an exercise using ALTERYX's geospatial capabilities to build a map and analysis using COVID-19 data supplied from Johns Hopkins. PK is the experience engineering firm, and PK and ALTERYX work together for the moments to deliver experiences for the moments that matter. PK has 4,000 employees in 4 countries with 22 offices worldwide. Our ALTERYX practice is part of our intelligence and analytics service line. PK has 5 service lines, including development and engineering, strategy and design, and automation and operations. PK supports you in a number of ways with ALTERYX, including advisory services, ALTERYX adoptions and deployments, end-to-end solution design, project services, and training, as well as accelerators such as custom data connections. PK is a top premier partner with ALTERYX. ALTERYX has 40 ALTERYX ACEs worldwide, and PK has 3 of them. We are certified across the entire ALTERYX platform and have deep experience in data science, spatial analytics, enterprise deployments, and APIs and third-party integrations. Our intelligence and analytics service line has offerings from BI to advanced analytics to data science and edge technologies. ALTERYX delivers solutions from BI and analytics to data science. I'm going to now hand things over to Andy to get things started.
Awesome. Thank you very much. Hopefully we can start to move the slides. So I'm Andy Day. I lead the solutions and go-to-market strategy for ALTERYX, and it is an honor and a privilege to be presenting on this webinar. First and foremost, I'd like to take a minute and ask everyone in the audience to really say a small prayer for all of the brave and courageous doctors, nurses, technicians, and first responders who are out there risking their lives for the rest of us. We really owe them a debt of gratitude. So quick look at what I'll be talking about are a framework for understanding the impact of COVID-19 and its implications for healthcare providers and public health. Quickly talk about our healthcare vision, strategy, and direction from an ALTERYX for healthcare perspective. Run through a couple of very interesting and meaningful value-based customer success stories from SCL Health and Texas Health Resources, which is located where Deanna and I are from in Dallas, Texas. And then turn this over to Deanna to talk about medical geography and its genesis, how it applies to pandemics and disease outbreaks. And then she'll actually walk you through an ALTERYX workflow that was talked about. So in terms of COVID-19, really from our perspective, as we know, it can't be, not enough to state that it's creating unprecedented challenges, given that it was completely unforeseen and, entire countries have been unprepared for. So everything from disrupted supply chains and the inability to protect patients and healthcare personnel. So 3 things that public health and healthcare is really focused on is first and foremost, how we protect our physicians, our caregivers, our nurses, technicians. Second, how do we best provide treatment for our patients who are being infected with COVID-19, especially the ones, developing complications. And so with the supply chain, with the clinical aspects, with the operational aspects, there's a huge data and analytics underpinning to all of this, which is what the ALTERYX platform addresses by transforming how data is accessed, analyzed, curated, and shared with executives, with line of business decision makers, with physicians, nurses, and clinicians at the point of care to ensure that, they can actually, help and cure people, right? So quickly, this is a framework that looks at kind of the 12 challenges which are urgent and imperative, which have, we have validated this, and it's gotten a lot of traction. So first and foremost, from public health, really at the transition, at the cusp of public health and healthcare is how do you track pandemics and disease outbreaks, deploy surveillance, and enable rapid response, right? For you to be able to look at data from previous pandemics, epidemics, disease outbreaks, etc., and understand really how this is spreading right across a country down to a county or a zip code level. As you can imagine, especially in the hot spots like New York, Washington, California, Louisiana, huge challenge because currently available, hospital beds are just not adequate. New York had, I think, about 53,000 beds, and they've expanded that to almost 300,000. So this notion of being able to identify and secure buffer facilities, what I call buffer facilities for additional ICU, ER, and additional hospital beds to cope with the surge is a huge challenge. My prognosis is it'll become a discipline as part of strategic planning going forward. As well, given the huge constraint on nurses, technicians, and physicians, how do hospitals recruit those who are retired and able, as well as about to graduate MDs and nurses whose experience can be brought to bear to deal with the crisis? 4, 5, and 6 really pertain to clinical operations and HR, so proactively identifying the most vulnerable patients and segments in the attributed population, which again, I'd say a lot of hospitals do by way of their population health segmentation, community health risk assessment, but this takes it to the next level. What is the impact of this for patients with cancer, COPD, emphysema, and cardiovascular disease, right? And the greater risk that they present. Given that seniors are being hit pretty hard and they tend to be locomotion challenges, etc., as well as the fact that caregivers need to be protected, there's literally an explosion in telemedicine and telehealth that is happening. But again, there are the underlying analytics to understand, stratify that at-risk population and do demand-supply matching with physicians and caregivers with them to be able to screen, qualify, triage them before they actually come to a hospital. At the same time, again, given this unprecedented, surge, hospitals do not have sufficient, personal protective equipment, PPE, gloves, and masks, etc. And so how do they protect their physicians and caregivers from infection, but also ensure that they don't experience burnout? 7, 8, and 9 really pertain to supply chain management, right? How do you maximize your ED, OR, and observation room utilization and patient throughput? We are in conversation with a hospital in the Northeast, which wants to convert its oncology beds into ICU beds with ventilators to deal with those patients with complications. Most of your demand forecasting just went out of the window. So from this pandemic, how do you learn and use some of these demand forecasting models to be able to secure and maintain adequate buffer supplies of PPE, masks, ventilators, etc., to cope, with the next one, right? And then, of course, you still have patients coming in with angina and those with diabetes and cancer and COPD who need to be taken care of, who have not been infected with COVID-19. So how do you balance that supply chain disruption, given COVID-19 with business as usual, right? So calls for new models, new analytics, predictive analytics paradigms to be able to do that demand supply matching. 10, 11, and 12 really pertain to core clinical care delivery. So it's one thing to, again, understand and predict, your patients in the population, attributed population at risk. But once these patients have come, especially the ones with COVID-19, how do you monitor them on an hourly basis and understand the ones who are potentially deteriorating or developing complications of respiratory diseases that need to be moved to an ICU with a ventilator. Quality and safety, hospital-acquired infections are usually always a challenge. How are these being exacerbated in the wake of COVID-19? And how do you use analytics to, again, ensure you're tracking the right metrics like CAUTI, CLABSI, et cetera, and ensuring that you can resolve them to not only protect other patients, your healthcare personnel, but also reduce fines and penalties. And last but not the least, how do you empower your care teams, your care coordinators to look after patients, especially those with complications who are being discharged? And happily, there are a lot of patients being discharged. So how do you deploy things like remote patient monitoring, telehealth, video conferencing, et cetera, to ensure that they're complying with medications, they're recording their vital signs, and perhaps most importantly, are they compliant with their follow-up appointments, et cetera, again, many of which are happening via telehealth and telemedicine. So again, not exhaustive, but these 12, I think, capture a lot of the challenges. So what is, how can ALTERYX help, right? So first and foremost, want to be extremely clear that we do not offer off-the-shelf products that will, tackle these challenges as is. As you can imagine, those 12 challenges map to hundreds and thousands of use cases. So we have helped federal agencies and NGOs respond to emergencies and disasters like this, and we are working with them via partners like PK to really help them build out the solutions, the analytics, and the advanced analytics solutions they need to deal with the disruption, right? We are also working with government, healthcare, and other organizations with a specialized set of offerings, right, that has been carved out in the wake of COVID-19, and some of them are listed here. We have a virtual solution center comprising some of our best SEs who have deep technical and domain expertise, who can actually work with you to solve your specific challenges. We are offering 90-day work-at-home licenses for everyone that has a designer license, given that everyone is working from home. Free trials are being extended to 30 days for any and all data workers that want to try the ALTERYX platform and deploy it for a specific problem. We have ALTERYX for Good, which shares ALTERYX licenses with not-for-profit organizations. We have a very vibrant ALTERYX community who are happy to share their expertise with ALTERYX to solve healthcare-specific use cases and share that knowledge and domain expertise with others. And last but not the least, we have an amazing ecosystem of partners like PK who have, again, ALTERYX aces like Diana, who work with partners to work with customers to solve their most significant problem. So quickly, let's go through what does ALTERYX offer for healthcare, right? Clearly, after COVID-19, we'll be returning to a new normal. And what are some of the use cases? Where can the ALTERYX platform help you solve your toughest analytics challenges? So one sentence kind of value proposition is we help you capture, prep, blend, and analyze data from multiple data sources. Having worked across 7 industries, one of my big epiphanies is healthcare has more health IT systems than any other industry, which is why it presents so many challenges to enable actionable insights at scale for superior business, clinical, and patient outcomes in healthcare. Let's unpack that a little more. What does that mean? So let's look at some of the use cases where ALTERYX typically finds usage. So everything from data extraction from electronic health records like Epic and Cerner with data prep and blending with other healthcare IT systems like Lawson, Kronos, and Presgen. It can be any healthcare IT systems. These are being cited just as examples. ALTERYX is a code-free platform for an analyst, and it's equally a code-friendly platform for data scientists. So it can be used for predictive and prescriptive analytics with machine learning and artificial intelligence, and of course, enabling and sustaining digital health initiatives across the organization. Now, let us quickly take a tour across the healthcare enterprise, if you will. So core use cases by line of business where ALTERYX is finding application and is delivering measurable value. Strategic planning and human capital management. We just launched a solution for locating your next healthcare facility. Very pertinent given the need to build out buffer solutions, right, in the event of the next disease outbreak or pandemic. Governance, risk, and compliance, clearly, again, with ALTERYX Server. Again, from an HR perspective, talent and performance management, labor productivity, managing employee satisfaction, including physician burnout, which is literally top of the mind right now. One of my predictions is, given the fact that hospitals are giving up a lot of their elective surgeries, which is going to have a pretty significant impact on their revenue streams, being able to manage and increase efficiencies and cut costs is soon going to be top of the agenda. And operations, assets, procurement, sourcing, and supply chain management clearly is the area where millions of dollars can literally be saved. Everything from ED and OR utilization and patient throughput management, which is top of mind right now, to reducing length of stay, 30-day readmissions management, but your core supply chain use cases, strategic sourcing and spend analytics, lowering off-contract buying with millions of dollars to be saved, supply and inventory forecasting, planning and optimization, getting the right drug of the right dosage to the right patient at the right time, imaging, supplier scorecarding, and performance management that a number of thought leaders are doing, as well as imaging and radiology utilization. Equally important, in an industry which has 2 to 3% net margins, finance and revenue cycle management is going to loom large, everything from audit and tax analytics to accounts receivable and collections management, reducing denials, which usually runs into millions of dollars for a mid-sized to large healthcare organization, reducing patient risk, given the massive, furloughs and layoffs that are happening, reconciling that with all of this funding, which the government is making available, and using analytics to map and make all that happen. And last but not least, pay for performance and total cost of care analytics. Equally important, the largest driver of analytics spend, in my humble opinion, over the last 4 to 5 years has been clinical and population health management. And we've talked about all of these in the wake of COVID-19. Clearly, everything from population health segmentation and risk stratification, top of mind as we speak, quality of safety, hospital-acquired conditions, top of mind as we speak, sepsis monitoring, but also slightly more strategic, accountable care organizations, population health metrics, and performance management, including things like value-based purchasing. Being able to bring all of those data sources together, getting a 360-degree view with metrics which can be made available to decision makers on a daily basis has been shown to save millions of dollars. Physician engagement, scorecarding, and performance management. We talked about care coordination across the continuum of care, increasingly precision medicine and outcomes analysis, as well as patient engagement, education, relationship management, which are again going to loom large. So given that we are short of time, quickly look at a couple of success stories before I turn this over to Deanna. The first of which is SCL Health. SCL Health is an integrated delivery network with about 8 acute care hospitals, about $2.5 billion in revenue, comprising 5 accountable care organizations. In this case, the focus was really on the supply chain analytics and reporting organization, tasked with integrating and overseeing all of their spend, right, other than the clinical spend, mandated with delivering about $15 to $20 million in annual savings, reducing clinical and business practice variations. And one of the things they had, they already had Tableau in place. They were measuring their KPIs and supply chain metrics with Tableau, and that was happening on a weekly basis, right? Some of those workflows are pretty sophisticated. Their objective was to really make those KPIs and metrics available and updated on a daily basis. So this is why they embraced ALTERYX. Twofold usage. First and foremost was to use the blending, prepping, data wrangling capabilities of ALTERYX to create curated data sets of both point in time and transactional data. We'll look at this. And secondly, to really drive automated workflows which fed their Tableau KPI dashboards, right, from a weekly to a daily basis. This is an example of a Tableau, the P2P with procure to pay, again, with all of the workflows driving it really done in ALTERYX. This is a quick look at that, the landscape. In this case, the Epic was their electronic health record, Lawson was their ERP, and of course they had medley of other transactional systems. So ALTERYX was used to create this nightly workflows, which fed this or created this curated data sets, which are used for reporting, right? And then they also used ALTERYX to automate the workflows, which fed not only the Tableau dashboards, but also for ad hoc analytics for their supply chain, folks, right? So this is an example of a complex and pretty sophisticated workflow created in ALTERYX, which culminated in this kind of, procure to pay dashboard, looking at what was their invoice discrepancy from a supplier perspective, really by supplier. And here's the impact, that invoice discrepancies was reduced by 17%, saving them about $100,000. Modest outcome towards that, big goal, but nevertheless a pretty good start. $60,000 in unnecessary software costs, which because they could now do all of that work with ALTERYX, and increasing spend under contract by 7%. So again, measurable, there's actually a link to the presentation they delivered at Inspire, and you can literally click and hear it from the voice of the customer. Quick look at another success story, Texas Health Resources, which is down the road from Deanna and me, one of the most important healthcare systems in DFW, with 26 hospitals, about $5 billion in operating revenue. In this case, they again had both ALTERYX and Tableau in place, the same analysts who were working on both. They created a center of excellence, but really wanted to ensure that their analysts were spending less time on manual commodity kind of work to really doing more value-added analytics work, right? And to be able to do that, they literally created a sandbox with ALTERYX server and the Teradata EDW, where again they created data sets from their significant healthcare IT systems, and then made those curated data sets available to these analysts who are equipped with both ALTERYX desktops as well as Tableau to be able to play with the data, to create various reports, etc. Both custom reports in regard to specific needs as well as ones that provided them insights for decision support. So I'll quickly go through three use cases, the first of which was predicting demand staffing, right? Very significant right now as hospitals are scrambling to find additional staff. So in this case, they had an R algorithm in place. They dropped that into the ALTERYX platform to be able to forecast demand from about 200 departments, and then visualized it in Tableau, as you can see from the orange display there, fairly in agreement with some of their with some of their historical data, which in turn, and as you can see, this will get even more significant in the wake of the pandemic. The second use case was automating the patient experience or HCAPS reporting to their senior executives. This was a repetitive monthly process with Press-Ganey data and Excel that they're investing about 30 hours per month. They automated this entire process with ALTERYX Designer and with Server into Tableau dashboards, which were then sent out as biweekly emails, improved an analyst productivity, saving about 400 hours. Last but not the least, improving observation room utilization. They found that there's a lot of variance in there, right? Clinical variance resulting in increased observation room stay, impacting their patient experience and satisfaction. So they used ALTERYX to blend and prep data from Epic, Press-Ganey, and other healthcare IT systems to be able to analyze those root causes. As you can see from this Tableau dashboard that put 2019 data, showing again 50% reduction in case variance, 22% reduction in length of stay, with again 800 analyst hours saved annually, because this was a pretty manual process. So now they have again actionable analytic, accurate insights for decision support for their execs and line of business leaders, and aligned with their objective, their data analysts have more time from data handling and data prep to devote to more value-added initiatives. But most importantly, they're seeing business and clinical ROI, if you will, with those metrics, right, from the observation room utilization, 50% reduction case variance, 20% reduction in length of stay, with 800 analyst hours saved annually in terms of higher analyst productivity. A similar story in terms of the HCAPS scores reporting, with 400 hours saved annually related to some of the manual work. Here again, we have a webinar with Michael Paris, who's their CDO and VP of Enterprise Analytics, recorded and available for you guys to address them as needed. Quick look at some of the healthcare leaders. So we have the good fortune of working with from both a healthcare provider and payer perspective. And with that, this concludes my section, and it is my honor and pleasure to turn this over to Deanna to take this away.
Excellent. Thank you so much, Andy, and great job. It is such a privilege to co-present with you today, so thank you for having me join you. I also completely agree with Andy. Thank you to all of the physicians and nurses and healthcare professionals, as well as the scientists and analysts and those emergency responders on the front lines for your tireless work. We truly thank you and owe you a debt of gratitude for all you do. So again, thank you for having me here. I want to tell you about medical geography today. And as Andy mentioned at the end of this, I'm going to be building an ALTERYX workflow using data from the Johns Hopkins University that's provided on GitHub. So I'll go ahead and take control here for the screen. And just to explain, what is medical geography? So it is the study of the relationship between spatial factors and disease. It's also called health geography, and it combines the science of epidemiology with the technology of GIS. And if you haven't heard of GIS, it's called Geographical Information Systems. So a lot of people think of it as computer mapping. And yes, we GIS professionals do make a lot of maps on computers, but we also do heavy spatial analytics as well as demographic analytics using lots of models such as gravity modeling, location allocation algorithms, and so on. So here's a list of a few things that you can do with medical geography. This is not a comprehensive list. This is really just the beginning. But some of the things we can do as medical geographers are look at disease rates and distribution and risk to public health, which is, of course, top of mind right now during coronavirus COVID-19. Also top of mind is healthcare and delivery of medical services and supplies. This is essential and it is a part of medical geography, so I'll talk a little bit about that today as well. And thirdly, I have listed climate, elevation, and physical geography impacts on health. I'm going to come back to that in a moment, but that may be something that's not really thought about as part of medical geography. However, it really does play a huge part. There's also demographics and lifestyle segmentation along with disease clustering. So you really can actually match disease clusters spatially with demographic data and lifestyle segmentation data. That segmentation data, commonly used in marketing analytics, is actually data that includes demographics, but also consumer expenditure, demand and supply, lifestyle, what kind of house that you live in, what kind of neighborhood you live in, and so on. You can actually use software such as ALTERYX to match those types of segments and demographics to clusters of disease, as long as you have a spatial component. And then here we have equitable distribution of resources, extremely essential. Not only resources for healthcare, as Andy was describing, but also equitable distribution of research. So for example, if you're taking water samples, say in the Dallas area, and you may only sample, say, from socioeconomic areas that are of middle incomes or high incomes, but you're not, sampling from all the areas in Dallas, that's not an equitable distribution of sources. So it's very important for your research to be equitably distributed as well, so that you can actually really know what's truly going on. And that's one of the parts of medical geography. So medical geographers ask the spatial questions. You're going to see a lot of where here in these questions. So where did the disease first appear? What is its pattern of distribution? Where is it spreading and how quickly? And who is it affecting? And again, where are they located? So we look at all of the wheres that happen with medical geography. We associate all of the healthcare, network distributions, and so on with where these patients and diseases are occurring. We also look at where are the potential populations that may be affected next. So in a disease epidemic, you may be able to model through predictive analytics as in ALTERYX and figure out what populations may be affected next and provide outreach to those populations, helping them prepare ahead of time. We also ask, why is it affecting some populations in one area and not others? I always say it's really not so much the disease that causes the spread, it's the human behavior, as we have seen, that causes the spread of a disease. It's socioeconomic factors, it's behavioral factors, and so on. So medical geography looks at that and analyzes, why is it here but not here? Why is it spreading this quickly in this area but not in another area? And what are those differences in those geographic locations? And lastly, are there health practices that differ between locations, such as hand washing, which we have found is very important not only during coronavirus COVID-19, but at all times. So it's very essential to learn about hand washing and how that really does prevent the distribution and spread of disease. So this concept has been around a while, much longer than many people realize. So Hippocrates of Kos, who was a Greek physician during the era of classical Greece, about 400 BC, he's often referred to as the father of medicine. He created standards for medical geography and epidemiology. His physicians noted the location and geography and the climate of their patients. He actually wrote that this is essential to figuring out how to treat the disease. He wrote the Hippocratic Corpus, which is a collection of over 60 works, including airs, waters, and places. It's one of my favorite things to read as a medical geographer. I've put the first paragraph here for you to peruse through. But if you're interested in reading his works, it is at classics.mit.edu. So feel free to look at the link here. So he really, in my opinion, got a lot of things right. He had these ideas all these years ago, around 400 BC, and many of these techniques and standards still apply today. So when I mentioned climate and geography earlier, this actually came from Hippocrates of Kos. And today, many physicians still take the Hippocratic Oath. So it's still applicable today as well. So medical geography also has standings, in the most recent centuries. So in the 19th century, John Snow, and not the John Snow of the George R.R. Martin, famous television series, but John Snow, who was an English physician, he utilized medical geography to trace a cholera outbreak in London back in 1854. He used counts of cholera cases, and he drew these outbreak locations on a map. As you can see here, this was actually his map, and he noticed the clustering of cases geographically. So you can see here all of these small little spikes. Each of these are a small mark that he made to denote where these incidences were occurring. And so when he utilized statistics, he not only applied those to where these cases were occurring, but he noted the sources of water for each pump, and he talked with residents in the area to confirm where they were getting their water. He found that the Broad Street pump, this one here where you can see this long line of incidences and fatalities, it had the highest number of fatalities. He then discussed this with the parish board, and the pump handle was removed the very next day. I want to stress the immediacy of these actions. That handle was removed the next day as immediately as possible, and it saved lives. So he's often noted as one of the founders of current epidemiology. This map is from Wikipedia. Feel free to look up John Snow on Wikipedia and learn a lot more about this fascinating physician who made huge advances in anesthesiology and in hygiene for health. So medical geography still applies today. You can see here a quote by the Robert Wood Johnson Foundation, and it does state that the evidence indicates that physical, social, and service characteristics of neighborhood influence health. They shape choices and behaviors. And with recent developments, we have seen how true that is. So I'm going to talk also about GIS. So I mentioned it is Geographical Information Systems. It is a new technology in the 20th century. This has been around actually about 50 years. So GIS is not quite so new as one would think. It actually has its beginning about 50 years ago with ESRI, or ESRI, which is a fantastic GIS system provider. And GIS allows epidemiologists and geographers to combine their knowledge and reveal patterns that you may not easily notice otherwise. It can overlay numerous map layers. So you can see here on the right, maybe there's a layer for land, another layer for streets, and another layer maybe for housing or populations. And you can overlay those and determine the spatial relationships between them. So you can apply statistics to discover the correlations, rate of spread of disease, healthcare facilities, and so much more. It also processes large amounts of detailed health-related data at one time, and it combines the where of health information with geographic boundaries such as cities and census block groups. You can trace this visually through time on these systems, and you can figure out where the disease was first noted, and then plot them on a temporal basis. So for example, a measles outbreak, you can take the data on a weekly basis, put it into a GIS, and then visually see the spread of the increase or decrease along with seasonality. Quoting Hippocrates here, seasonality does play a part in disease, and you can view this in a GIS. So it's not just about disease, though. It's also about improving the accessibility and availability of healthcare services. So I've listed here some data and analytics. They include hospital locations, specialty clinics, provider offices, along with specialty type. Very importantly, patient access to those provider offices. And as we've seen recently, equipment distribution and inventory management is part of medical geography, and emergency services. Those are essential aspects of medical geography analytics as well. You can analyze demographics to see those patterns at the census block group level. And you can actually see the data at block group, census tract, city, county, and so on levels using the Business Insights bundle in ALTERYX. So for example, some areas have a higher incidence of cardiovascular issues, and other demographics have higher rates of cancer. That's just been proven. Why not use research and medical geography to match those healthcare providers that specialize in those issues with those areas? That's definitely something you would do in medical geography. You can also do site selection models for hospitals and other healthcare facilities. This will benefit those underserved populations. This is actually something that I specialize in. So site selection is not just for retail and restaurants and real estate, the 3 R's, but it's also for healthcare. And location and allocation models show servicing demand from a set of points. This is for optimum distribution of healthcare services to patients and to those healthcare professionals. So we've seen these pandemics come up in the 20th and 21st centuries. In 2003, we saw the rise of SARS, and that was caused by a version of a coronavirus spread to over 20 countries. In 2009, H1N1 was first detected in the US, and then it spread worldwide. 2012, we saw MERS, or Middle East Respiratory Syndrome, also caused by coronavirus, originated in the Arabian Peninsula and spread to other countries. We also saw in 2014 Ebola. So this was noticed globally in 2014 because it crossed continents. However, it was first noted in 1976 in Africa and still continues today. In 2014, we also saw the avian flu. Dr. Phil Riggs of the U.S. Department of Agriculture presented his work in ALTERYX at the Inspire 2016 conference. You can see the link here for the slide share. Feel free to utilize that and review his topic of improving avian influenza emergency response with ALTERYX. It was a fascinating study. And then in 2019, we saw the rise of coronavirus COVID-19 worldwide distribution. I'm going to show next how to build this map in ALTERYX using the COVID-19 data from Johns Hopkins University that's provided for public use through GitHub. You can see the link here. So I'm going to use confirmed cases as of April 3rd, this week actually. But before I make the map, I wanted to show this quote. So as I was researching information for this webinar, I found this quote from the New York Times by Jim Robbins in 2012, 8 years ago. It talks about epidemics such as AIDS and Ebola and SARS, and it states they don't just happen. They are a result of things people do to nature. And did you know that 60% of emerging infectious diseases are zoonotic? They originate in animals. And then this article states that more than 2/3 of those originate in wildlife. So they're not originating in your household pets, you know, the domestic cats and dogs. They're originating in wildlife. So I thought this was a really interesting article and posted 8 years ago. So when you have time, feel free to read this article of the ecology of disease. I also want to give a shout out to my mentor and major professor of medical geography, Dr. Opong, who's a professor of geography at the University of North Texas. And he states very clearly and very applicably, in a globalizing world, a disease outbreak anywhere is a threat everywhere. So we are truly a globalized world. Almost every country is interconnected. And if you do have a disease outbreak somewhere, it can be a threat everywhere. So here are some references. You can see most of them are from the CDC. And then I'm going to build the ALTERYX workflow. So I'll go ahead and share my screen here. And then for ALTERYX, I have this workflow up that I've built using the GitHub data. And the GitHub data actually comes from this data here. It is comment delimited, and it is provided on the GitHub website. And I want to give a huge thank you to Johns Hopkins University, the Center for Systems Science and Engineering, for posting this data on a daily basis. So thank you for your tireless work doing this. And also for GitHub for posting the data here so that everyone has access and making this available to all. So again, you can download this data. Again, it's comment delimited. So I'm going to actually build a new workflow and show you from the start what this looks like. So I'm going to pull in an input data tool. And I also wanted to mention, since this is recorded, and if you do have ALTERYX, you can watch this later and follow along on how you would actually build this. So I'm going to go to my files here, and I'm going to pull in the GitHub data. I always make a backup just in case of my data here. It's in an Excel file. I simply copied and pasted it. And you can see here, here's the comma delimited data in the preview. So one thing I want to do is state that the first row contains data. This will actually give me a way to parse this data for the headers that are also comma delimited. So I'm going to click on first row contains data. It's going to start the data import on line 1. So I want to show you what that looks like. I'm going to be adding browses after every one of these tools so that those who are not used to ALTERYX can see what the data look like as they come out. And now you can see I have a header called F1 and then all of the data here together. So now I'm going to actually parse that data. We do have some really great parsing tools in ALTERYX, and I've been using ALTERYX since 2005, so actually before it was ALTERYX. So you can definitely know that this is one of my favorite software to actually utilize, and it runs in virtual memory, so it processes data very, very quickly. So here I'm going to split that column of F1. I only have one column. My delimiter is a comma. There's a lot of data. So once this is parsed, there's a whole lot of columns. I'm going to put 90 columns in there. I'm going to leave the last column here, and I'm going to put the output root name as F1. I'm also going to show you some data here. So when I show this data in the Browse tool, you may have noticed that the data for cities and states, and if I can grab this, kind of hard to grab there, is actually here, and it's in quotes. So thank you to the people of Johns Hopkins University and GitHub for making those in quotes for the city and the state, because that makes it easier to parse. So in my parse tool, I'm going to click on ignore delimiters in quotes. So I'm going to add another browse tool. And so ignoring those delimiters in quotes is going to allow me to look at the city and state. So now my data are parsed. I have the original data here, and then I have the columns that are parsed here. I have a latitude and longitude, and then I have the information here for the US. So I can actually get into the data and see a lot more quickly how I want to parse that data even further. So once I have this data together, my very first header is actually a the very first data here on line 1 are actually my columns. So I want to make those columns my headers and replace the headers of F1 and so on. So to do that, I'm going to go over to my developer tools and pull in a dynamic rename. So a dynamic rename is going to allow me to rename those first rows. And in a dynamic rename, I'm going to change it to take field names from first row of data. I'm going to make sure all of the columns are selected here. So once that's applied, now I'm going to add another browse tool. Click Run to push the data through. And now you can see I have column headers now. So now I have that province, state, and country, and so on, all appropriately as headers, so I can use these now. Now that I've got this appropriately parsed, I'm going to use spatial tools. So I'm going to bring in a create points tool. So since I have latitude and longitude data already, I can simply create those points using the longitude field and the latitude fields already present in the data. So again, thank you to Johns Hopkins University and GitHub for providing the longitude and latitude data. It makes it very easy to put together this information. So now I've geocoded it, I've created it with a lat long, and whenever I'm using spatial data and I'm creating points, now I have a spatial object. So ALTERYX holds the spatial object centroid as a field inside of the data. You can see here when I scrolled across, these are all the data up to the date that I downloaded it. So I'm going to use the data from April 3rd of 20. So first I want to actually filter, and in ALTERYX that's really easy to do. I'm going to filter just for the US data coming through this. So I'm going to set up a really quick filter, and this filter column is going to be country and region equals and then US. So you can see here in the custom filter, it puts it into the appropriate syntax. I'll just leave it as a basic filter here. And then I'm going to open up that data in a browse tool. And you can see here, this all should be US data for my country and region. So part of the download was that, but I wanted to confirm and make sure I do have only US data in this data set. So I'm going to also add a select tool. There's a lot of fields I don't need. I'm only using the April 30th or April 3rd data. So I'm going to deselect all the fields, but I'm going to utilize some other fields in here. So the ones I want to keep are actually latitude and longitude. And then I also want to keep a province and state just for data coming out. And then I'll scroll down and I'll choose the April 3rd data and the centroid. It's essential to have that centroid to use that on the map. I also want to change this April 3rd data to a numeric format. So I'm going to change it from V-string to a double. That way I can actually do some thematic mapping on this. So once I've run that, now you can see it's going to be a much reduced data set. I have only a few columns now, only the ones I need. And then you may notice some of the data have zeros. So I'm going to add another filter. And I'm going to filter this out and say for my filter that I want to have 43020 is not equal to 0. That way I only get the data from the true output that does not equal 0, and then I can utilize that. So now I have output. All of the data here does not equal 0. And then if I look at the profile, I can actually look at the data a little better. So I can see more about this data. If I wanted to look at the data in the profile here for the select tool, I can actually see the numbers coming through. So I can actually see what my leading white space is, shortest, and so on for that data. So it's nice to be able to say, okay, here's my data. I've got this actually changed to a numeric format now. And that 4320 is now a double. So once I've got this put together, I can actually start making a map from it. So this is one of my favorite parts of ALTERYX. I'm actually going to bring in the report map tool. So it's here in the reporting options, and bring in the report map tool and create a quick map from this. So a report map tool can take in more than one input. So what I'm going to do is use my data. My data is input number 1. I'm I'm going to change the spatial object to a centroid, and I want the thematic field to map on to be 4320. I want it to be that data that I'm going to group and actually create the thematic heat map from. For the layers, I'm going to import this points layer. It's now add layer, points layer number 1. And then I'm going to make some changes. I'm going to change the style. I want it to be actually a circle. And then for the size, I think I'll actually leave it at, make it 12 here. And I'll make an outline color of black. So theme, though, is where the magic really happens. I have options for smart tile, equal records, equal ranges. I can manually set my limits, or I can do a unique value. So I'm going to do smart tile. This actually uses the standard deviation and shows above and below the standard deviation here. I'm going to ramp my color method, so it's going to actually span between a light color and a dark color here. So I'm going to make this a light color here of a light pink for my start color, and then my end color, I'll make it a maroon here as well. So now that I've got these themes together, you can see I can do high, above average, average, below average, and low. So now I actually have the data coming through. I also want to change on my data in my layers. I want to make sure in layer number 1, I don't want to zoom to that layer, because that layer actually encompasses not only the continental US, but outlying areas such as Guam and American Samoa and so on. I just want to focus straight on the US here. So I'm going to go back to my favorites and pull in an input data tool. And I'm going to pull in a boundary I created of the continental US. And I created that boundary in ALTERYX. I simply took all the states and then I combined them together into this US boundary. So I'm going to show you what that boundary looks like, and we're going to use that as the map extent so that we only look at the continental US here. So here's the boundary of the polygon. And again, I just took all the continental 48 states and put those together. So I'm going to bring that into the mapping tool as well. So I'm going to drag it over to the map tool. This is going to be input number 2. And then in my map tool for my data, there's input number 2. We want it to have the combined spatial object. For my layer, I'm now going to import a polygons layer for number 2. And then for the polygons layer, I'm going to change the style just a little bit. We're going to keep it as an outline color, but no fill. And then we're going to make the opacity, or non-see-throughedness, as I like to say, 100. So it's going to be a dark black line coming through there. We also want, in our layers, we want to zoom to that layer, but we don't really want to show it in the legend because we already know it's the US boundary. So now that we've got all of this together, I can add a browse tool. And then I'll run and show you a browse of that map and then how you would output that map as a PDF, for example. So it's generating the map here. I'm going to look at this boundary here, and now you can see the map. I'm going to open this in a new window. So here's my map, color coded. You can see average is that medium color, low are the lighter colors, and high are the darker colors. Here's the New York area, as we have seen, and then Florida, and then of course the West Coast here. There are other ways to show this data on a map, but in the interest of time, we don't have time to show those, but feel free to reach out to me if you have questions on how to do that. Also, I'm going to add just a render tool. Render is the output tool for the reporting options. And so I'm going to do a render, just a temporary PDF document. I'm going to make it landscape so we can fit the legend on there as well. And my data field is simply the map. And then I'll click run. So once this runs, you'll see in my results window a pop-up for that PDF. And then that PDF can be emailed to other people. You can add a title and all sorts of things. So this is one way of using that publicly available Johns Hopkins University data on GitHub to make a map in ALTERYX of that very same data. You could take this data and say, I only want to look at cases of 1,000 or greater, and then show a map and what that looks like, and so on. You can also change the size of the circles if needed. So with that, I also wanted to add that I truly hope that this analysis in ALTERYX and a bit of information about medical geography really inspires scientists and healthcare professionals and analysts and just people everywhere to work together to develop a vaccine and to hopefully find a cure as soon as possible for coronavirus COVID-19. I really want to say let's all combine all of our skills and talents and gifts to improve healthcare and to optimize delivery of equipment and supplies to those who need them, including the healthcare professionals out there. And let's use all software that we have at our fingertips, everything available to us and all of our abilities to help during this time. So I hope that this has helped in many ways for you, and feel free to reach out to me on the ALTERYX community. My handle is @Deanna, D-E-A-N-N-A, also pronounced Deanna. And again, I'll switch here so you can see our contact information for PK for more information. So again, thank you to Andy and to ALTERYX for co-hosting and presenting this webinar, and also to the PK Global staff and PK for hosting this webinar as well. And I wanted to open it up for any questions also. And I'll also check in the chat for the questions as well.
Thanks, Dina. So I'm going to just go through the questions that have been submitted, and then you and Andy can address them as I read them. So the first question is, could you use ALTERYX to create a short video or GIF that shows the geospatial change over time?
That's a great question. And in fact, you can. There's a bit of work. You would do a bit of that GIF or animation outside of ALTERYX, but you would take these maps in ALTERYX and output them as a PDF or even as a JPEG. You can output as a JPEG from the browse tool here. Do a new window, and then you can output the JPEGs from here. And then you would take those JPEGs and you could either put them as slides in a PowerPoint and animate those through time as a PowerPoint animation, or you might feed them into like Jiffy.com where you can actually create a GIF from those. So you can output the images through time. These would be static images, but then animate them through time using PowerPoint or another software.
Great, thank you. Next question is, does ALTERYX have a pre-built integration to electronic health records like Epic, Cerner, Allscripts, and NextGen?
Most of our customers actually use the native ODBC connectors from ALTERYX to be able to work with those electronic health records. So, it hasn't been an issue. Almost every one of our healthcare customers uses ALTERYX to draw data not only from one or more electronic health records, but also healthcare IT systems like ERP, like revenue cycle management, like PresGini for patient satisfaction, Workday, etc. So yeah, you can virtually work with any healthcare IT system out there and draw data into ALTERYX.
Thank you. So we only have a couple minutes left, so we're gonna do one more question, and the rest we will respond to and send answers to the participants in an email. The question is there a way to create map iterations, for example, by state or region?
You can actually. So there is a data set in ALTERYX, or you can actually load in third-party data sets. There are boundary data sets available on census.gov on the website through the Tiger shapefiles. Just Google Tiger on the census.gov website. Or you can go into ALTERYX, and in the demographic analysis, there's an allocate input tool. And that allocate input tool actually provides a lot of geographic boundaries. This is with the Business Insights Data Bundle. That's an additional purchase with ALTERYX. But you can see here we can get down to census block groups, tracts, counties, and states, zip codes, even CBSAs as metro and micro standards. And you can use those boundaries and iterate the maps using the exact same data that I pulled in today, or other data that you decide to pull in.
Okay, great. Thank you.
Mhm.
I think we might have time for one more question. Let's see here. One of the questions that came in is, where can we learn more about ALTERYX?
I think that's an excellent question. Go ahead, Andy.
Yeah, so, you know, the ALTERYX website, alteryx.com, is a treasure trove of information. But the ALTERYX community is another treasure trove of information where you can literally go in and, you know, search for specific use cases you're interested in, look at customer case studies, look at, you know, training tools and education tools, etc. So between both of those, there's also an ALTERYX, you know, YouTube, you know, site, if you will, where you can literally, again, look at presentations from Inspire, you know, customer case studies, et cetera, But I start at alteryx.com, and I'd also go to ALTERYX community to look at, you know, some of those valuable resources that are available. Deanna, do you want to add to that? What other resources that you found valuable?
Oh, yes, thank you so much. And the ones you mentioned are perfect. There is the ALTERYX Academy on the community.alteryx.com and alteryx.com main website. That's actually how I learned ALTERYX, is starting on the community, and not only through the Academy, but you can post a question anytime on the ALTERYX community and you will receive a response pretty quickly. So there are people around the world who are constantly posting answers and including workflows sometimes for you to download and utilize on the ALTERYX community. And the 40 ALTERYX ACEs are also on that community, and we are also posting answers and solutions many times. So feel free to reach out and utilize that very valuable, and as Andy mentioned, a treasure trove of information on the community as well.
And might I add, if you come up with an innovative use case or workflow, please contribute it back so there are others in the community that can learn from you.
Absolutely. I love that idea, and I completely agree. Thank you, Andy.
Great. Thanks to both Andy and Dina for their time today and the information that they shared. I just want to thank everyone else for their time in joining us, and hope you found great value in the presentations. And just a reminder that we will be sending an email with a link to the webinar recording, and have a great rest of your day. Thanks, everyone.
Thank you very much.